tetanus. So the main objectives of my lecture is to define tetanus, know the causative agent and its mode of transmission. This is important in every topic in infectious disease. You have to know the causative agent. For example, is it bacterial, is it viral, is it fungal, is it parasitic, etc. And very important, its mode of transmission. Also, you have to know its epidemiology and describe its important clinical features, how you can, every infections agent, you have to know the pattern or the modes of presentation, and able to know the tetanus and differentiate from other similar diseases, similar presentations of tetanus. Also important therapeutic and preventive options. In each infectious disease, you have to know the main line or the, for example, the antibiotic of choice and the main preventive options. So prevention is very important in the infectious diseases, how to prevent the disease. So how you can define tetanus? Tetanus is the acute onset, very important. So the onset would be acute within few hours. The acute onset of hypertonia, which means that there's sustained muscle contractions, hypertonia, or painful muscle contractions. So it is a painful process, painful muscle contractions. This is what we mean by hypertonia. And generalized muscle spasms without other apparent medical cause, because there are a lot of causes of muscle spasms. So if you have a patient with an acute onset within hours to a few days of acute onset of painful muscle contractions after exclusion of other causes, so this is definitely tetanus or tetanus. Okay, so this is the definition of tetanus. What about the etiology of tetanus? As you know from the bacteriology, Clostridium tetani is the responsible organism for tetanus. This is the Clostridium tetani. It is anaerobic. This is very important. So it is not aerobic. It is an anaerobic organism and needs special culture. So we can growth able to cultivate this organism. So it is anaerobic, gram-positive, spore-forming rod. So it is a spore-forming rod. Unfortunately, spores resist boiling and many disinfectants. So these we cannot get rid of these spores, which are the mode of transmission and the cultivation mode for this disease. So spores usually resist boiling, so it will not be killed by boiling and many disinfectants, like alcohol, for example. The spores or bacteria, how you can get this disease, the spores or the bacteria, the viable bacteria. You have two modes of infection. You have either the spores or the bacteria enter the body through abrasions or wounds. So the patient may not recall an incident injury. So small abrasions are enough to get and more to the bacteria or spores to get into the body. And once in a suitable anaerobic environment, so very important, anaerobic environment. So in a patient with, once these enter the wound and anaerobic or environment maintained, so the organisms will grow, multiply. Until this stage, the patient will be asymptomatic, but once the toxin would be released, which is an exotoxin, so it's released from the bacteria, rather than the bacteria itself. From the bacterial, you know there is exo and endotoxin. So exotoxins were released from the bacteria, and this exotoxin enter the nervous system and cause the disease. So we have an entry mode, either the abrasions or wound, in multiplication and cultivation of the organism, followed by a release of toxin. So the clinical manifestations of tetanus will be responsible by the exotoxin rather than the bacteria itself. So the exotoxin will be responsible for the whole clinical manifestations of this disease, tetanus. Keep in your mind that superficial abrasions to the limbs, especially the lower limbs, are the commonest infection sites in adults. Okay. On the other hand, deeper infections rather than superficial, it will be responsible for more severe disease. Why? Why super deep infections are more associated with the most severe clinical manifestations? What do you think about Why the deeper infections?
Doctor, may reach to the blood?
Superficial abrasions also may reach the blood. Okay. But because deeper infections are more suitable for anaerobic infection, superficial abrasions close to the surface, close to the atmospheric air, so it will not allow the organism to multiply freely because of atmospheric oxygen, while deeper infections usually away from air, away from atmospheric oxygen, this allow a more suitable environment for the bacteria to grow and release its toxin. ذلك المريض اللي عنده deep injury, for example, artery and the fractures, and for example, soil get deep into the wound without cleaning and proper debridement. So this will leave the organism grow rapidly, multiply and grow rapidly, and release subsequently the toxin. What about the epidemiology of the disease? It is a classical disease. Persons more than 6 years of age are at a greater risk of tetanus. Why? Because the antibody levels decrease, or what we call it wane over time. يعني عادة حتى البيشنت اللي ماخذ vaccinations, full vaccinations after the age of 60, these antibodies and this immune response will wane over time. يعني شو wane؟ يعني decrease. So the antibody response will be decreased. So every person should have a booster doses of tetanus vaccine every now and then to boost the immune response. So persons above the age of 60, this is very important epidemiological point for the release of tetanus. It may occur in neonate, what we call the neonatal tetanus, because the immune response is not primed, ready for this disease. لكن نسوي proper vaccinations, this disease nowadays become rare. In pediatric age group, more common in old age group, and نشوفها بالadult and geriatrics if they missed the booster or doses of this disease. What about the pathogenesis? Once the toxin released into the bloodstream, they undergo the toxin, tetanus toxin undergoes retrograde transport. What we mean by retrograde? So from the peripheral nerve back down to the central nervous system. So undergoes retrograde transport into the central nervous system. What we mean by the central nervous system, شنو معناها? The spinal cord and the brainstem, in addition to the brain, cerebrum. So it go backward or retrograde backward from the peripheral nerve down to the upward to the spinal cord and the brain, and thus produce its clinical effects. So how would you approach to the patient? So the clinical manifestation of tetanus, keep in your mind, occur only after tetanus toxin reach the presynaptic inhibitory nerves. Unfortunately, so the initial growth and multiplication of the bacteria would be silent, and after release of the toxins, nothing we can do to the patient because it is reabsorbed to the backward to the presynaptic inhibitory nerves. Once these effects become apparent, there may be little can be done to affect the disease progression. يعني high toxins once reach the bloodstream and taken back by the presynaptic inhibitory nerves, unfortunately, there will little can be done to affect the disease. So tetanus is very important preventive disease. So the role is to prevent the disease rather than treat its clinical features and complication. وهذا شباب هسه approach to the patient and the pathophysiology of the disease process. This is very important to know. There are several forms of tetanus. We have the generalized from its name, so it will be generalized muscle spasms of the body muscles, the head, neck, the trunk, and the extremities. We have the cephalic part, which would affect the head and the neck, cephalic part, and the local. And for example, painful muscle contractions of the upper limb or the lower limb, what we call local disease. This depends on the dose, يعني the patient received the cumulative or the inoculum of the organism. يعني طبعا the large inoculum and deeper infections usually associated with more generalized. While the cephalic means that, for example, for certain trauma, facial trauma, and local tetanus, this form of the disease usually in a patient will have some immune response, because the immune response will limit the release of further toxins and limit the disease process if the patient has already antibodies against the tetanus and this toxin. So this is a very simple scheme to summarize the pathophysiological process and its clinical manifestations. As you know, this is the Clostridium tetani. It's a gram positive, a very distinctive shape under microscopy. Okay, this is a gram positive spore-forming rods. After a minor injury to the wound, example, it will be taken by the bloodstream back to the presynaptic inhibitory nerves and down to the spinal cord and the brain, and it will be responsible, especially it will affect the motor nerves, the anterior horn cells, and the brainstem become hyperactive. So after taken by the presynaptic inhibitory nerve, it reaches the motor neurons, and it will be responsible for the painful muscle contractions. For example, as you saw in this phase, there will be muscle contractions of the platysma, the sternocleidomastoid, also the facial muscles. So spasms of the jaw is very characteristic feature, spasms of the jaw, painful muscle contractions of the jaw, the masseter muscles, facial, neck muscles, and the look jaw. The jaw cannot be even open or open. Rhizus sarcoidanus, specialist smile facies, what we call rhizus sardonicus. Dysphagia, because it is a skeletal muscle, so it will affect the whole skeletal muscle in the body. So the patient could not able to swallow water. The dysphagia is very important and responsible for the one of the dismal prognostic features in patient with tetanus, aspiration pneumonia, because of the patient could not swallow its saliva, are often early symptoms. مرات المريض يجينا فقط the earliest manifestation of the tetanus هو lockjaw and dysphagia. طبعا تعتمد على depends on the variable incubation period. The generalized form of tetanus, generalized whole muscle contractions, so will be complete tetanic spasms, and then advanced disease. The patient will become rigid because of sustained muscle contractions. The arms extended and the back will be arched. يعني the back, arching of the back, extension of the plantar flexions of the foot and dorsiflexions of the pectorals. So this is the whole muscle contractions. So the back of the patient could not lie down on the bed, what we call the opistotonic feature. This clinical feature is usually associated with poor prognosis because the whole muscles will be affected, and it means the large toxin have been produced since the incubation period. This is another example of painful muscle contractions of the jaw and the neck muscles. So this is the classical picture of patient with tetanus. So the most clinical features or most common clinical feature the trismus, or what we call it lockjaw. يعني يجي المريض ما يقدر لا يفتح حلقه بعده ولا يسد حلقه. lockjaw نسميه. ويجون القوارب in this complaint trismus, lockjaw. In addition, there will be muscle pain, cramps, stiffness as a result of hypertonia, back pain as a result of contractions of the paraspinal muscles, difficulty in swallowing, what we call dysphagia. So there will be sometimes ruling of saliva from the mouth of the patient. Commonly, the laryngeal muscles are involved early or even in isolation. So after dysphagia, the laryngeal muscles commonly involved early in disease. So the patient may have شو تتوقعون the laryngeal muscles involved in a patient with tetanus? What are the expected clinical manifestations if the laryngeal muscles are involved early in the disease? What are the expected clinical manifestations? The larynx muscles will be involved, so there will be spasms of the laryngeal muscles. شو تتوقعون يعني شنو clinical manifestations of the disease?
Or difficulty in breathing.
Okay, good. Difficulty in breathing.
Hoarseness of sound.
Cough, may or may not. Yes,
Hoarseness of voice.
Yes, Ahmed, very good. Hoarseness of voice. The patient cannot talk because of muscle contraction. The patient cannot talk freely. But so there, dysphonia is very important. Dysphonia, so there be abnormality in the phonation of the sound. ما يقدر يحكي بصوت طبيعي بالإضافة لأنه البيشنت cannot breathe in a comfortable way. So there will be what we call stridor, an abnormal noisy breathing. أخذتوه بالrespiratory, usually inspiratory. So there will be inspiratory sounds, abnormal sound, because of painful contractions of the laryngeal muscles. There will be dysphonia, and dyspnea طبعا very important بالإضافة لل hoarseness of voice. So keep in mind in a patient presented with lockjaw and hoarseness of voice, so this patient has tetanus until proven otherwise. Here's a question to you as a homework. What is the more commonest cause of death in tetanus? Okay. The commonest cause of death in tetanus. Okay. Another clinical, so after the toxin has been taken down from the presynaptic inhibitory neurons, two systems would be affected. The musculoskeletal system, which is responsible for the main or the most clinical manifestation of the disease as a result of hypertonia, painful muscle contractions of the skeletal muscles. In addition, there will be autonomic, after they have two types of neurons affected, the motor neurons and the presynaptic inhibitor that connect to the central nervous system and the autonomic nervous system. So as a result, the autonomic nervous system will be also affected in addition to the skeletal system. So there will be autonomic disturbances, which would happen usually during the second week of the severe tetanus. عادة نشوفها بالsecond week. So the first week, the patient will complain of the painful muscle contractions in various portions of his body or her body. Later on, in the second week of the disease, there will be affection of the autonomic nervous system. Okay, يعني هنا عادة شو تتوقعون شنو the patient has affection of the autonomic nervous system? What be the expected clinical manifestations if there is involvement of the autonomic nervous system as a result of the toxin released back to the presynaptic neurons?
ايه دكتور، غير كل الفانكشن تأثر يعني من الهارت بيت للشوتينج يعني ل موتيليتي الهابت يعني مالتها إلى آخره.
Okay, so there will be involvement of the vital organs. For example, the cardiovascular system, the autonomic nervous system that affect the cardiovascular system. So the patient may have sudden onset tachycardia or bradycardia. Tachycardia or bradycardia. These are the manifestations of the central nervous, autonomic nervous system that control the heart. In addition to that, labile hypertension. يعني المريض نجي مثلا الصبح نلقى hypertension، بالليل يصير hypotension. This is an autonomic disturbance. Yes, there will be sweating or maybe dryness, respirations. All these functions are controlled by the autonomic nervous system. Maybe مثلا for example, say it's complete paralytic ileus because it's part of the autonomic nervous system. Ileus, there will be abdominal distension, constipation, urinary retention. Okay, so these ذلك second week ممكن المريض شو يتوقع عنده arrhythmia, hypertension, hypotension, abdominal distension, urinary retention. So the autonomic nervous system would be affected. So in a patient with tetanus should be admitted to the intensive care unit with close monitoring of his vital organs. How we can diagnose culture? شو تتوقعون what is the best method to diagnose tetanus? يعني عادة إذا جانا مريض عنده tetanus, what is the best or the rapid method to diagnose tetanus?
دكتور الايزوليشن او السيرولوجي يعني؟
دكتور السمير لأن شكلها يكون مميز.
يعني مش يعني Abbas, you mean that you diagnose tetanus by the clinical features? You mean?
لا أقصد يعني يأخذون عينة ويسوون لها سمير حتى يشوفوها تحت الميكروسكوب فيبين شكلها لأن شكلها مميز.
So you mean you take a swab from the wound and undergo the gram staining of the to know its morphology, the characteristic morphology of the causative organism. Okay, probable. But
نعم دكتور.
Yes, but keep in your mind that tetanus, if you delay the treatment or the management of tetanus, there will be rapid deterioration of them. Within 1 week, a patient will have generalized muscle contractions. So the main clinical or the main tool to diagnose tetanus is the mode of presentation. So it depends on the clinical manifestations of the disease. All these tools, it takes time. So the culture needs time. The serum anti-tetanus, it also takes time from the lab, serum tetanus immunoglobulin. So the best method to diagnose tetanus is depending on the clinical features. So if you have high index of suspicion, treat the disease unless until the further diagnostic tools will be available. يعني انت اذا شكيت مريض تطور عنده تتنس please don't delay treatment والله حجز تحليل او انتظر الكلتشر او so it depends on high index of suspicion. There are other differential diagnoses for tetanus. For example, in strychnine poisoning. This is a poison used to kill dogs, strychnine poisoning. Dystonic reactions, for example, in a patient who received, for example, antipsychotropic drugs, anti-seizure drugs, neuroleptic drugs. Sometimes it will be manifested by painful muscle contractions of the neck, and so this is how you can rule out by taking a good history from a patient if there is a recent ingestion of drugs that have that are culprit in inducing these dystonic reactions. In addition to the oropharyngeal infections, for example, odontodental infections, اللي عنده مثلا patient and the tooth abscess, there will be also lockjaw or trismus. So oropharyngeal infections may cause trismus. يعني مريض مرات يجينا هم يقدر يفتح القد يعني you cannot open his mouth or her mouth due to odontodental infections. This would be easily differentiated from tetanus by examination of the mouth, looking for edema or swelling. In a patient with tetanus, mouth examination would be normal. So this is a very simple clue to diagnose oropharyngeal infection. That is responsible for example, trismus or lockjaw. Dystonic reactions, usually differentiated from tetanus, sometimes difficult to diagnose, but drug histories here is very important clue to diagnose dystonic reactions. Strychnine poisoning, history of ingestion of the culprit medication would be easily, because otherwise the strychnine poisoning would be very similar to patient with tetanus. So these are simple clues how you can differentiate it. Otherwise, all these diseases or differentials will cause muscle contractions and variety of manifestations that are similar to tetanus. So what about the treatment? So the main pillars for the treatment of tetanus is that you have to treat the entry wound. Why? In order to stop the growth or the multiplication of the bacteria. In addition to kill these bacteria by the antibacterial therapy. So you have to clean the wound, exposure to the atmospheric oxygen, in addition to the antibacterial to stop the bacteria, to stop the production of toxins. Antitoxin to neutralize. شنو فكرة الانتيتوكسين؟ To neutralize any unbinding toxin. And for example, the bacteria release its toxin still in the circulating in the bloodstream. If we give the antitoxin, we are able to neutralize further toxin uptake by the presynaptic inhibitory neurons in order to lessen the severity of the manifestations. Okay. In addition to the supportive therapy. For muscle contractions, we can give muscle relaxant, oxygen therapy, control of tachycardia or bradycardia, in addition, etc. So this is the main pillars for the treatment. So if the patient have a wound, especially dirty wound, يعني صار عنده trauma, in the war trauma, for example, or trauma during work contaminated with soil. ومين يجي عادة tetanus? Soil, because the spores are ubiquitous. يعني it is present everywhere عادة. It's present in the soil. So if you have a wound, a dirty wound, we mean contaminated with soil. So this should be thoroughly clean and thoroughly, okay, clean thoroughly. Then after that, we have to ask about the vaccination status of the patient. So if the patient has high risk, for example, 6-year-old, we may give antitoxin بالإضافة إلى شنو؟ إنه نعطيه booster dose for DTaP, which is the vaccine that contains tetanus. What about the prognosis? Yes.
دكتور اسف على المقاطعه بس بال10:30 عندنا كويز احنا.
اوكي كملت المحاضره ان شاء الله tetanus. So the prognosis will depend on the time of onset. يعني شنو time of onset؟ يعني from the wound till the first clinical manifestation and the length of incubation period. Definitely the shorter the incubation period, the higher the worse the prognosis. كل ما incubation period تكون قليله كل ما disease يكون أسهل. more severe. So what about the prevention? The prevention, definitely good wound care by thoroughly cleaning the wound, and in addition to that, ask about the immunization status of the patient قلنا مثل ما قلنا إنه giving the booster doses of vaccine. Okay, you have to give booster dose of vaccine if the patient is not vaccinated, or we reschedule the patient for vaccination if it is not happened at all. And thank you for your attendance. If you have questions, please do ask me in chat in the Google platform. اوكي شباب، شكرا على حضوركم، اتمنى لكم التوفيق.
شكرا لك دكتور.
عفوا.